In hospitals across England, the pressure is unrelenting. Winter always brings more frail and elderly people in, but this year our wards are fuller than ever. So more patients than ever are ending up stuck in A&E, like Philip, who spent 6 hours on a trolley after suffering a mini stroke last week.
The scene is very, very depressing and worrying, because you immediately see these trolleys with people in various states of physical breakdown. As I said, some of them have got masks on, so they're quite seriously ill. They lay out flat, they're not moving at all.
Yesterday, the Health Secretary told me only a limited number of hospitals were struggling.
There's a few hospitals which have had very sustained and difficult problems.
Today, A&E doctors spoke out to challenge that view. There are 152 hospital trusts in England, each with a target of dealing with 95% of A&E patients within 4 hours. But a snapshot survey by the Royal College of Emergency Medicine suggests 4 out of 10 A&E departments in England are only managing to deal with 75% of patients within that target time.
There is a real crisis out there, and I do not know what world the Secretary of State inhabits, but it's not the world that my colleagues in A&E departments throughout the country are experiencing on a day-by-day basis at the moment.
Last night on his way home, surgeon Rishi Deer came across a cyclist who'd been hit by a car.
So this is an emergency. You can't move these patients because they could potentially be paralysed.
At work and off duty, he sees a service stretched beyond its limits.
I called the ambulance and they told me that they'd be at least 50 minutes for a trauma patient who was an absolute emergency. And then on coming to work this morning, I found that my operating list, because I work as a surgeon, we didn't have the beds available to do the non-emergency operations as well. This is a problem because of underfunding, because of cutting throughout hospitals, and something needs to be done about it.
The usual pattern is for winter pressures to peak in the 3rd week of January. That's next week. And with freezing temperatures forecast, which always increases demand, A&E staff and their colleagues across the NHS can only brace themselves for the days ahead. Catherine Jones, 5 News.